Welcome back. Chapter 16, Sexuality and Intimacy is what we will cover. As always, these are the terms that you should know. Make sure you understand them, and if you have any questions regarding these terms, please reach out to me. In our introduction, we will talk about sex and controversial subjects. We're going to cover the whole subject of education on sexuality, some of the attitudes over the years that pertain to the older adult, and some of the ignorances and prejudices related to sex and the older adult. Let's look at this question. Is the following statement true or false? Great if you answered true. Let's read the rationale. Okay, now as you review this slide, which talks about the attitudes towards sex in older adults, just remember as you're reading each of the bullet points that we need to change our thought process on how we approach older adults, dealing with our attitude and how we perceive them to have sexual activities or thoughts. You know what, they're the same as any other person. We're to treat them the same and not go, oh my gosh, they're old and how can they even be thinking that way? So no, we need to get the stereotypes out of our head, view towards sex in late life. It leads to sex issues being ignored. So remember that these individuals are individuals. Older, the only difference is 65 and older, and they still have the desire to have sexual activity, thoughts, or concerns. Now let's look at this question. Is the following statement true or false? Excellent if you answer true. Look at the rationale. If older adults learn that a sexual partner is HIV positive, they may be embarrassed to seek medical attention, and when they do present with symptoms to a healthcare provider, the symptoms are not associated with HIV simply because the person is old. Please remember, when you're doing your assessment, don't leave out any sexual things that you need to ask. You know, you can ask, are you having any discharge, any painful intercourse, or are you having pain? Those things we need to ask, or if not, you know, the older adult is going to be left out, and it's just not fair to that particular population. As we talk about menopause, now let's remember that it is the inner beauty of age versus the physical beauty of youth. So we need to understand it. It is a sensation of the menses. It is an important transition in a woman's life. More than a physical experience, it's an awakening of the body, the mind, and the spirit. It is always good to notice how to manage symptoms and to provide education for those going through menopause. As you read this slide, you know, there are different hormones that patients can take. Some have ideas of some of the women go through hot flashes, mood changes, and some of the ideas of certain hormones that you take, natural things you can do, things that you can avoid. As you notice, if you eat certain chocolates, it may make their mood change, or just out the blue, the person might get hot or sweaty. So there's different things, but it's also good to educate. So when the symptoms do arise, the patient will know what to do. So some women are against hormone therapy and some are for. So everyone is their personal choice. So the Women Health Initiative is estrogen and progesterone increase heart risk. So estrogen alone, less risk. So some folks do not like to be put on both. The age at the start of hormone replacement therapy alters the risk. Individual decisions for treatment, they may not want to do any of it. So we just need to learn how to manage their symptoms. I won't speak much, but I just want you to know about the self-acceptance and our role in helping to guide the women through the changes with menopause. I want you to read each of these. so you can get a better understanding. Now let's talk about andropause. Now we know that as testosterone levels decline in men, it does not occur in all men. Remember that. Low testosterone levels in older men can result in reduced muscle mass, energy, strength, and stamina. So other changes like erectile dysfunction, breast enlargement, osteopenia, osteoporosis, and shrinking of testes. So all of these things, let's be aware of them. And if your patient do come to you with those complaints, let's reach out to resources that can assist them. Look at the realities of sex in older adulthood. Look at each of these. Health professionals lack experience in discussing sex with any age group. Some do, some don't. Medical and nursing assessments lack inquiry of sexual history activity. Sometimes we have the questions there, but once we get to that question, the nurse kind of skips over the question. Remember, we need to promote understanding of older adult sexuality. Let's not skip questions. Let's ask the questions and just basically stay professional when you are talking about a really sensitive subject. Please review the sexual behaviors and roles. As you review intimacy, look and see, are these some of the same feelings that you will want? Remember, everyone is the same. The difference is, once again, we're speaking about the older adult. Look at our age-related changes in sexual response. Look at bullet point number 3. Regular sexual expression for both sexes is important in promoting sexual capacity and function. Also, bullet 1 and 2 are very important as well. 1, older adults physically able to be sexually active. Age-related changes have impact on sexual function. Let's look at this question. Which statement is true related to age-related changes in sexual responses? If you answered C, great. There is a decrease in sexual responsiveness in both genders. Please read the rationale. With life, we do have lots of barriers. And with sexuality, so be it. Barriers still exist. So you have physical, emotional, and social variables have impact on older adults' ability to remain sexual active. So also don't forget about the disease processes that they have going on. They also have multiple or comorbidities, right? A lot of things that are barriers for them, the medications that they're on. So we have to understand the barriers that they're going through. Look at this slide. Unavailability of a partner. Look at bullet point number 3. Tendency for men to marry younger women. And look over here. Most older men are married. Most older women are widowed. By age 65, 7 to every 10 women. And by age 85, 1 man to every 5 women. And then lack of partner, particularly for women, because women, they marry older men, maybe 10, 15 years older. And then what happens? Unfortunately, their partner pass away, and then they end up being a widow. As we continue to talk about barriers, look at the psychological barriers. Wow. Look at number 3, relationship issues, concerns about the body image, fear of losing sexual abilities, negative attitudes from society is a big one, misconceptions by older adults. So all of these things are barriers that we don't feel like, oh, but when people make statements about older adults, that bothers them psychologically. Please look at the medical conditions. Look at bullets 1, 2, 3, and 4. Kind of touched on them a little earlier, but please pay attention to these. We talked about earlier and hinted on erectile dysfunction as one of the problems. But look at this. Let's look at it a little bit more detail. Impotence or erectile dysfunction, unable to attain or maintain erection of penis for sexual intercourse. Imagine how that might feel psychologically. Now you have multiple causes. Here's all your causes. I won't read them out to you. Look at the physical exam. So make sure that the patients are getting a physical exam, okay, to determine if there's any barriers that's causing this to happen. And then medical treatments and other options are available. Lots of options are available. There are departments that specialize in men's sexual dysfunction. Now I know we all should know the answer to this one, but let's see if we get it correct. Yes, 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 you are correct. Diabetes. I talked earlier briefly about medications. Here are some of the effects of the medications. Look how we can promote healthy sexual function. With identification of problems and potential solutions, sexual history, part of the nursing assessment, nurses' preparedness for openly to discuss sex, realistic framework for sexual functioning, and of course, basic education. Don't forget, and there's more, please read this slide. As you review this slide, as we continue on promoting healthy sexual function, look at each of these bullet points. Special consideration for institutionalized older adults. Masturbation beneficial. Holding, caressing, exchanging loving words as means for sexual satisfaction. And nurses must foster positive attitude. Okay, well, thank you. I promise you it will be less than 15 minutes. Please either email me, come by during office hours, or what's the other way? Or you can call me if you have any questions. Thank you and take care.